FUT or FUE में major differences, and this will change your entire myth and knowledge about FUT and FUE. First thing, you will be told that FUT has more damage, has lesser follicle to graft ratio. Come, let's have a look. So what we showed you was that when we are doing the FUT process, all the roots are preserved. There is no damage to root if the correct angle is taken, if the correct procedure is followed. Almost 99% of the hair that is taken out is viable and alive. This is not the case with FUE. FUT 5 to 8% damage rate is known. So FUT has much better graft survival compared to FUE. The second major myth, FUT grafts are much more long lasting, have higher longevity compared to FUE. Why? Come. So when we see here, this is the marking of the permanent zone and this is the marking of the permanent zone below. But there is hair below this marking as well, and there is hair above this marking also. Whenever your doctor is doing more than 2000 grafts with FUE, the problem is they have to take hair from here as well as here as well as here. And this is semi-permanent zone. That means in future that will follow. If they stick to the permanent zone and take too much of hair, I'll show you what will happen. So this is the FUE device. So if I make holes 1, 2, 3, 4, because I have to do a lot of hair, because I have to take out too much of hair, I will keep making holes like this. This entire area will get bald. If I have to give gap between hair so that there is no damage to the donor area, I cannot take too many grafts. So this is the second major problem with FUE compared to FUT. The third biggest problem of FUE, if you see closely here, this is the top end of the graft. If you see, there is a lot of skin here. It's like a mushroom. And then the hair roots come. So this extra skin, where it is implanted in the front hairline or on the beard, will stick up as a mountain, also called as cobblestone. Therefore, FUE grafts should not be put in either the hairline or on the beard, but definitely not on the beard unless we prepare the graft. So understand this now. Again, this is the graft, this is the roots, and on the top, this is the skin. So you have to cut this extra skin and only implant. In FUT grafts, this is never a problem. So cobblestoning is a real problem with FUE grafts and does not happen with FUT grafts.